Hey there, this is Dr. Evan Osar with Chicago Integrative Movement Specialists. Thank you so much for tuning into this webinar where we're going to discuss why omega-3 may be the most important nutrient for the health of you and your family. Before we begin, an important disclaimer. Don't stop taking your current medication. Don't start taking supplements without consulting your healthcare professional, and do discuss any questions about your nutrition, supplementation, and or medication with your primary care or healthcare professional. So a recent article in the Journal of American Medical Association came out in 2012, and the researchers looked at the association between omega-3 fatty acid supplements and the risk of major cardiovascular disease events. And what the researchers found out after pouring through all the research on 68 to 70,000 patients, they found that omega-3 fatty acid supplementation doesn't lower risk of all causes of mortality, doesn't lower the risk of cardiac death, sudden death, myocardial infarction, and or stroke. So what I want to discuss here is this concept of omega-3s not helping to decrease any of the things that we hear omega-3s are good for, like improving cardiovascular health, circulation, overall general health of our body, and why actually omega-3s we should actually consume more of in our diet for health. So first of all, let's discuss what are omega-3 fatty acids. Well, essentially omega-3 is an essential fatty acids. And there's three kinds of fatty acids types that are found within food sources. And they're alpha-linoleic acid, which can be converted into EPA and DHA. So again, there's alpha-linoleic acid, EPA and DHA. EPA and DHA being the active compounds within the foods that are beneficial to our health. And we'll discuss some of those benefits in a minute. The ideal ratio of omega-6s to omega-3s is actually 2 to 1. So for every 2 omega-6s we get, we should consume at least 1 omega-3. And we'll see why that ratio is often skewed in our current diets. So what are the benefits of omega-3? Well, one of the most important things it does for us is anti-inflammatory. Most of the foods we consume in our diet, grains, meat, alcohol, cheese, are all inflammatory foods. Omega-3s that come from fatty acids, nuts and seeds, and plant sources are anti-inflammatory. They decrease inflammatory reactions in the body, and most of the disease processes that occur in the body are actually inflammatory processes. So this is probably one of the most important nutrients we can consume in our daily diet to help the overall health of our body and improve our longevity. It also protects the cell membrane. Cell membrane of every cell in our body is surrounded by a phospholipid layer. So it's a fatty layer that helps protect and move nutrients in and out of the cell. And omega-3 makes up a lot of those fatty acids that form the cell membrane. So it helps the health of our cells. It's also a blood thinner. A lot of our clients and patients are on blood thinning medication. Omega-3s are naturally blood thinners, so they improve circulation by keeping the blood nice and viscous. It also improves bone density, so it actually helps absorb many of the minerals that are necessary to increasing our bone density, and as well it helps our immunity. And during this time of the year when people tend to succumb to more colds, flus, viruses, omega-3s can boost our natural immunity. One of the best ways it does that is through the first thing we discussed, is anti-inflammatory. So the more you can decrease inflammation, the more you can boost your natural immunity. So what is omega-6? Again, omega-6 is also an essential fatty acid. It contains linoleic acid. And the sources of this essential fatty acids are the common food sources that most of us consume. Corn and corn oil, safflower oil, soy and soy oil, and canola oil. Again, these oils and this fat is beneficial, but the problem is we consume way too much omega-6. So again, remember, we talked about the ideal ratio of omega-6 to omega-3, 2 to 1. Most of us and most of the current American diet is consumed of 10 to 30 omega-6s to 1 omega-3. And what is the problem with consuming too much omega-6s and not enough omega-3? Well, it contributes directly to a lot of the things we see as disease processes and compromised health in our clients and patients. One of the most common things we see, joint pain. Chronic joint pain, arthritis, inflammatory joint conditions are created by too much omega-6s and not enough of the anti-inflammatory omega-3s. Dry skin, dry hair, dry nails can all be contributed or attributed to too much omega-6 and omega-3, or a lot of these conditions can be contributed to that. Memory. When we have decreased memory, inability to recall things sharply, even Parkinson's and Alzheimer's conditions have been related to not enough omega-3s and have been benefited from supplementation of omega-3s. So again, because our brain and our neural tissue is so comprised of omega-3 fatty acids, if we're not taking enough, we will suffer neurologically and through our memory. Depression, so again, affecting the ability to make certain hormones and decrease inflammation of the nervous system, and also decrease immunity and increase in allergies. So being more allergic to things, decreasing our ability to fight off things because of this increased inflammatory reaction, and again, not being able to produce enough of the chemicals that help protect our body. So where can we get more omega-3 fatty acids? Where the best sources come from are whole food sources. So we all know and we've heard salmon, cold water fish like herring, sardines, tuna all contain high levels of omega-3. Do you have to worry about mercury? Yes, you do. So again, consume fish, but not every single day. So a couple times a week, but get more omega-3 from other food sources like free-range eggs and meat. So again, conventionally raised meat, animals are fed grains. Free-range and grass-fed animals, so again, we should put free-range and grass-fed, are these animals are eating the food they're supposed to. Animals are supposed to eat grass. When they eat grass and they're allowed to roam, they actually have a higher level of omega-3 in their meat. So again, they are also like fish in the fact that they're eating the food they're supposed to, so they produce more omega-3 and therefore are healthier choices. As far as plants go, flaxseed, chia seed, hemp seeds all contain high levels of omega-3. And again, your body still has to convert that ALA into DHA and EPA. So again, it's not as efficient as consuming the ALA from animal sources. But again, if you're a vegetarian and or you don't eat a lot of free-range or organic meat and eggs and or fish, these are great sources to add to your diet and very easy to throw into recipes, salads, create muffins, throw it into your cereal, and it adds a nice nutty taste. Get the chia seeds. You can get them at any health food store, and most regular grocery stores carry them now. And flaxseed, in the image to the left, get the flaxseed meal where the seed is already broken up. So the other benefit of these sources of flaxseed, chia, and hemp seeds is they actually contain fiber and protein and low carbs. So again, carbohydrates in excess is the problem in many of our diets. So again, we can get our fiber through chia seeds, hemp seeds, flax seeds, and of course, a lot of nuts like walnuts, almonds contain a lot of omega-3 that can benefit our health. It's another reason we want to exercise is because exercise helps metabolize fatty acids. It takes a lot of the bad fatty acids out of our bloodstream, circulates our blood better, and it also improves the good fats in our system. So, conclusion. We want to increase omega-3 and try to get it through our whole food sources. Fish, nuts, and seeds like chia, hemp, and flax. Try to get it from whole food sources, preferably organic when you can find it and if it's cost effective. And only take supplements of omega-3, fish oil, and or flaxseed oil when you've consulted your healthcare professional. Because again, if you're on medication and or you have other health concerns, be sure to discuss this with a healthcare professional. I want to thank you for watching this webinar and hope it helped you remain informed so that you can make informed decisions about choices that affect your health as well as the health of your loved ones. If you like this webinar and feel that it can help others, please feel free to pass it on to your friends, families, and coworkers. This is Dr. Evan Osar of Chicago Integrative Movement Specialists, and we'll catch you next time where we'll discuss topics that are relevant to you so that you can take control of your own health and make informed decisions. Take care.